Hello, I'm Lizzie and I'm 37 years of age and I live in Exton Chorley. I'm a member of the Brothers of Charity Voice for All advocacy group. Voice for All aims to give people with learning disabilities a voice. I would like to share with you some of the experiences I have had when using my local health services. I have learning disabilities and use a wheelchair to help me get around. As you can imagine, I am sometimes faced with challenges getting out and about, especially when going into or moving around buildings. About 4 years ago, I had to visit my GP to have some vaccinations. My wheelchair would not fit down the corridor of the surgery to get into the treatment room, so I ended up having to have my injections done in the corridor. This made me feel upset and exposed, as I was aware that people were walking up and down the corridor around me. I would not have been able to cope without my helper who was there with me. I told the practice that I was not happy and ended up changing my GP to a practice that my wheelchair would fit into. I am pleased to say though that over the years, more buildings are becoming more accessible for people like me that use a wheelchair. With regards to the health staff that I come into contact with, most of the time people have a positive attitude towards me. As much as I rely on my helper, I sometimes feel annoyed when people talk to my helper and not me. This makes me feel like I've not been listened to. Having a helper is very important to me, but please speak to me, I am here. I have had some really good experiences of going into hospital. I use a system called Red, Amber and Green, which can also be known as the hospital passport. This is a system used by people who have learning disabilities that gives hospital staff important information about them, which can help make their stay a better experience. The red section tells people things that they must know about me, such as my name, my date of birth, my medical history, medication and allergies. The amber section gives people information about things that are important to me. This could be things like how I eat or drink. Do I have difficulty eating? How do I let you know that I am in pain or I'm not feeling myself? For example, if I am bored, upset, worried, lonely, or I need some attention. The green section tells people about my likes and dislikes. This is things like listening to music, physical touch, restraints and things that keep me safe. It would be good if more health services could use this system. I've noticed over the years though that positive steps to support people with learning disabilities have been made, such as buildings becoming more accessible, as I mentioned earlier. There is also more information available in easy read. Some organisations use audio formats to get information out. It would be good to see the NHS sending information out like this instead of letters. Thank you for letting me share my experiences with you.